talk a little bit about this whole idea and the concept and the importance of what we have talked about, and hopefully try and address the various questions, arguments that various people have raised. I want to start off talking about the impact of tobacco in the South Windsor community, but also in the society in general, and exploring the common arguments made against the ban. So the impact of tobacco in the community, 1 out of every 5 people that die in the United States die from a tobacco-related disease. It is the #1 preventable cause of death in the US. And the smokers die, unfortunately, about 14 to 25 years younger or earlier than their counterparts who are non-smokers. The cost of healthcare and the lower productivity, according to 2004, the numbers have gone up, is about $194 billion to our economy. And if you look at the value of life, and I'm sure most of you, and if not all, value life, 5.1 million years of loss of life annually in the US. And that is the impact on the society. Back in 1912, medically speaking, by studies, it was identified that tobacco was a problem. Cigarette smoking was a problem. And unfortunately, 100 years later, we're still having a conversation about this topic. Think about it, 100 years later. And I just want to put this is amazing, from the art lovers. Vincent van Gogh, back in 1886, painted this. So many, many years, even before science had identified, he was actually painting this to give a message. And this is at the Amsterdam Museum right now. So these are the common arguments that you'll hear from people who say, oh, this is not an issue in South Windsor. Well, let's look at that. According to Centers for Disease Control, on an average, 17% of the high school students and 5.2% of our middle school students themselves identify themselves as smokers. It's not somebody else telling that they're smokers, they are calling themselves smokers. More than 80% of the individuals who are smokers start before the age of 18. Extrapolate the numbers for South Windsor, we may have approximately 258 high school students in South Windsor who would identify themselves as smoker, and 52 middle school students in South Windsor who would identify themselves as smokers. These children will live 14 to 25 years less than the other kids who are not smoking. 14 to 25 years less. Each cigarette will lead to about an 11-minute reduction in their lifespan. And it's well recognized by the International Agency for Research in Cancer. Passive smoking is a cause of death. It's a cause of fatal diseases and cancers. Benzene, formaldehyde, arsenic, ammonia. If somebody was exposed to benzene at the workplace, they would get compensated for it. And that is what the person next to you who's smoking is exposing you to it. I didn't make this up. This is real stuff. The next question comes, can we ban the sale of cigarettes in pharmacies in South Windsor? Well, according to our lawyer, the equal protection claim, and this is what San Francisco, when the case was there, resulted in, the result from the judge was that the ban is legitimate and compelling. The due process claim, again, court found the argument reasonable and permissible. The First Amendment grounds, selling cigarettes is not a protected expressive activity. It is not a protected expressive activity. And that's what our lawyer has helped us understand. So legally, there is growth and there's reality into this. This is doable. Does this mean that we are now going to ban Slurpees, alcohol, sports cars, etc.? That is a common argument that you will come across in these situations. Well, answer is no. None of the other products, when used above their required amount, are dangerous. There is a limit to how much alcohol you can drink. There is a limit to the speed of the car that you can drive. There's a limit to the amount of the candies and sweets that a person can have if they don't have a disease. But is there a safe level for a cigarette? There's no such thing. And the cigarettes actually are not killing the person next to you in the process either. Think about it. There's no safe recommended amount for that. We have a responsibility to protect the minors from making wrong choices and being provided mixed and wrong messages. This is our responsibility. Argument 4. We heard that very eloquently. Why target a pharmacy alone? Why not a convenience store? Is this a conspiracy to send business to smaller stores? That's the amazing thing. When you don't want to agree with something, you say, oh, it's a conspiracy. That happens everywhere. There is only one pharmacy in South Windsor. If there were 20 pharmacies selling cigarettes, we would be hoping to ban cigarettes from 20 pharmacies. There's only one pharmacy because the other independent pharmacies have been eaten up by CVS, if you will. And the independent pharmacy associations are against the sale of tobacco smoke. That's what has happened traditionally. And let's talk into this a little bit. A pharmacy is a place you should go to get better, not to get cancer. Cigarettes are prominently displayed along the healthcare product and normalizes their use and reduces the stigma associated with smoking and leads to increased use. The American Pharmaceutical Association has said this. Mass display of cigarettes in pharmacies is a direct contradiction to the role of pharmacy as a public health facility. That is the American Pharmaceutical Association saying. Study done out of Yale University studied the pharmacists across, and they saw 82% of licensed pharmacists were against the sales of tobacco products in pharmacies. 82%. According to the American Pharmacy Association and National Community Pharmacists Association, it is an inherent conflict of interest for pharmacies to dispense the medication that treat heart disease, lung disease, and cancer, and then turn around and sell tobacco. Support for advertising in pharmacies. This is from Washington University study on public opinion. Majority of the public is against the pharmacies that are going to be marketing their products, as well as other grocery stores and places too. Again, this is the important point that some of the people have brought up, is the point of sale environment. The point of sale environment is a critical issue, where at the pharmacy the point of sale environment gives a mixed message, but the convenience stores are also doing the same thing. They're giving mixed messages right at the point of sale, and that is the sneaky way of marketing it to the young people. And that's an issue that we will have to deal with at some point. CVS, actually, their mission statement is to say that they're supposed to help the health of people. You can't have a mission statement to support the health of people and then turn around and sell cigarettes at the same time for making money. Think about it. They're profiting from disease and death. And pharmacists who want to enhance their spectrum of service, they are not allowed to do so, because the main argument that everyone else is making in the healthcare industry is, how can you enhance your capacity to perform medical care when you actually can't even stop your own employers from selling cigarettes? And the pharmacists, you talk to our CVS pharmacists, they would be hesitant and scared to talk about it. They say, look, I'll lose my job, I can't talk about this. And 82% of them are against this. American Medical Association has made this statement as well, that there should be no tobacco sales in pharmacies. And creating clinics in pharmacies, it's again, if I'm a physician, it would be unethical, wrong for anybody who's providing clinical care to sell cigarettes at the same place. How can you do that? And that is more of a reason, Kathy, that is more of a reason not to do it, because they are actually taking care of health. People are going there for their infections, respiratory problems, and then you turn around and you walk away with a cigarette. I mean, of all people who have smoked should know that. It's not a political issue. It is not us versus you, it's not me versus, it's our children. Think about it. When a child takes up a cigarette, that child is going to not look at it whether he's a Democrat, Republican. Don't make it into a political issue. It is an issue of health of our children, our future as our town. These are the towns that have done it. These are the towns that have already done it. It's not out of the blue. If you want to know the blogs about CVS, very simple. Go to Google. Go to Google. First 50 things you will see will be about this whole issue. And to say somebody comes up and say, oh, well, there's nothing on the web about it. There's songs written about CVS killing people with cigarettes. Well, this proposed ban is unfortunately not going to have an impact on one of the largest sales source in our town. That's Stop and Shop, I believe. Because they're not selling pharmacy. They're not selling, it's not a pharmacy. But CVS is the only pharmacy in town. The future, we have to address the point of sales advertising.